Fox 5 News. In tonight's Anchor Mom, we put aside the politics and put a face to healthcare reform. We wanted to find out just what's in it for kids and how it'll impact local families. Here is one such family who is thrilled it passed. A face to healthcare reform, 10-year-old Allison Casper is bright, beautiful, and incredibly sweet.
Come and get me. Come and get me. I can't.
So much so, her blood sugar can get the best of her. Diagnosed with type 1 diabetes at the tender age of 4, a year later, another devastating diagnosis, celiac disease, a 1-2 punch that knocked the wind out of her mother as she scrambled to learn how to help her daughter survive.
It's such a balancing act, and every day is different. There's no 2 days, I don't think, that we've ever had where it's just been really easy.
Such a balancing act, her daily meals require a scale to count every carb, calorie, and nutrient to make sure her blood sugar doesn't go too high or too low. A routine Allison has down flat.
Serving size, which is on here, 50 grams. So I press in 50. The nutrients, which is the carbohydrates, is 44.
Allison also wears an insulin pump as her constant companion and does not let the disease define her. But from a health insurance company standpoint, that's exactly what it does. It defines her as someone with a pre-existing condition, something that could make her uninsurable.
Prior to the health care reform, if he had lost his job because she has a pre-existing condition, she would be uninsurable. And, for us, it'd be one visit to the ER, and that could devastate us financially.
It's one less worry for a family who relies on frequent doctor visits and pricey medical supplies just to keep their daughter alive, doing for her what her body can't do. They also have to prepare special gluten-free meals to cope with her celiac disease.
And basically, she has a gluten-free diet. We have to read all our food labels to make sure that there's no wheat or barley, rye, or oats in her food.
A way of life, or a way to sustain this sweet little life, despite what her brother Josh might think at times.
Don't tell me you lost this state too. No?
Healthcare reform may not list peace of mind within its thousands of pages, but it's a piece to the healthcare puzzle in America many families like the Caspers were missing.
It's just nice knowing that she can't be turned away, even with a pre-existing condition.
And to talk more about exactly what's in the healthcare reform package specifically aimed at children is Dr. David Granite, Chief of Ophthalmology at UCSD. So I want to thank you for being here. And out of those thousands of pages, this is something we really do need to break down for parents. But I'm curious, as a medical professional, what kind of report card would you give it overall when it comes to children?
I think it's a first step. And as a pediatric ophthalmologist, that's important to me dealing with kids. The pre-existing condition issue that you just showed, it touches everyone's heart. And imagine being a family worried that you can't move, or if you change jobs, or if you want to be entrepreneurial and start a business, your child may not have health care. That's a big deal. And so the fact that the new health insurance change allows that those kids cannot be prevented from getting health care, that's a big deal. I think that's a mark of a caring society, is that we're going to take care of our children.
So that's an A+ in that regard. Let's talk about some of the other specifics that are aimed at children directly in this package. Coverage till you're 26 years old.
Yeah, that's an interesting one, right? That almost doesn't sound like kids anymore when you get to be that old. The idea, though, is that between 18 and 26, so many of those people are just healthy, and they're not making a lot of money, so they decide not to take health care. And what that does is that puts them in a position where they can be bankrupt, and it costs the system a fortune. So by allowing them to stay on their parents' health insurance, then the insurance system is taking in money, so they're getting paid, and those people are covered. So by allowing that, they've changed that group of people from uninsured to insured.
And what about Medi-Cal rates? You talked about that and preventative care.
Yeah, well, if doctors don't get reimbursed enough to even cover the cost of the care, they're not going to choose to see the patients. And Medi-Cal doesn't pay very well. Around the rest of the country, it's Medicaid.
Right.
And it just doesn't pay nearly as well as, for example, Medicare. By raising those rates, they allow doctors to see these patients who must get seen. In fact, in hospitals, it's going to be very important because, for example, at UCSD,